Hi, I'm Rob from the Novel Biomechanics Lab. If you're a diabetologist, today I would like to explain why pedography is so important for your work. Among the 420 million people who are diagnosed with diabetes, 1 in 5 is confronted with the pressure ulcer in the form of a neuropathic foot ulcer, also known as diabetic foot syndrome. It is typically seen as a complication from the patient's angiopathy or neuropathy. To prevent this type of ulceration, so-called pressure peaks, which the patients themselves may not perceive, must be detected before it is too late for ulcer prevention. Since pressures are not visible, they can only be measured with sensors. Pressures on the foot may also be influenced by external factors such as footwear fit and adaptation. Therefore, a standardized measurement method and environment is required for optimal assessment and care, similar to X-ray and MRI standard care. How does the measurement with the emed work? Here we see an emed pedography system. The emed is a flat pressure sensor measurement plate over which the patient walks to capture the pressure data. The emed XL platform, which can measure the dynamic load under the foot, consists of more than 25,000 sensors that we have developed in our 40 years of experience. We are now viewing the foot contact rollover process, also referred to as the stance phase of gait. The warmer colors, such as magenta, display the area of highest pressure. Peak pressures of 600 kPa or higher may indicate a high risk of plantar tissue damage and ulceration. What type of information can be received from the emed? The measurement trial is complete within a couple of minutes. The patient walks across the sensor platform and the immediate feedback displays the peak pressure range. Here you can see the dynamic pressure image of a patient with increased peak pressures shown as pressure mountains or peak pressure valleys for each sensor element. At first glance, you can see which areas have high peak pressures. This information is helpful when communicating with an orthopedic footwear professional about appropriate footwear modifications. For persons with diabetes, this iGel service represents the opportunity to consider further treatment options with you. A regular follow-up protocol may support the patient in a more conservative treatment plan instead of a surgical intervention outcome. Provide your patients with this opportunity and start using the emed sensor system for your pedography measurements.